So Ultraformer is basically HIFU technology, which is highly intensified focused ultrasound. And it allows us to focus sound at 4.5 millimeters, 3 millimeters, and 1.5 millimeters. So when we are talking about 4.5 millimeters, we are actually targeting SMAS, which is actually the muscle which is under the skin that helps to keep our face in its position. And 3 millimeters, we are addressing the connections of the dermis, which are branching into the SMAS. And then with 1.5, of course, we are targeting the dermis. So this way we can tighten and lift the skin as well as the SMAS, which we call the non-surgical facelift. Basically, when I'm trying to sort of address the face, I like to treat all over. We can typically work on the mid-cheek grooves, we can work on the nasolabial folds, we can work on the hanging jowls, we can do the framing of the face so that your face looks more sculptured, and any hanging or sagging tissue can be addressed. But when we are treating the skin, we also have to treat the skin around the eye, around the neck, because that is the skin that actually ages faster than the other areas. So basically, whenever I try to treat, I try to tailor-make the treatment and I try to address the whole face. But of course, depending on the budget of the patient, we can do specific areas like the upper face, the mid face, or even the lower face. Actually, I have a lot of patients, especially when you're looking at the younger generation, they are more bold. They are ready to do treatments which are actually showing, and people can tell that they're doing aesthetic treatments. But when we are treating people who are a little bit older, in their 40s or 50s, I think they're a little bit more conservative. They want to look natural. They don't want to look an artificial, filled up or bloated look, right? So a lot of ladies I have done, and usually the recommended treatment is one treatment, and it actually rewinds the age by 5 years. But my trick is 2 treatments. I always do 2 treatments, 2 to 3 months apart. And I say, if you look at your photographs 5 years or 10 years back in time, there is a difference between 5 years and now, but there's a much bigger difference between 10 years. And even I think recently there was a challenge for 10 years younger in Instagram, and when you were posting your photograph now and 10 years back. So I think two sessions of Ultraformer gives you like at least 10 years age rewind. Whenever we are looking into adapting any technology to our clinical practice, we actually study the market, and I try to sort of go for machines, and especially energy-based devices, which are more versatile and flexible. Ultraformer actually gave me the ease of use, speed, as well as the accuracy. And what we can do is we can tailor-make the treatment specifically for each and every patient. We can go into every nook and cranny of the face and address different layers of the skin at the depth that we want and at the speed we want. And when you're doing a treatment, at the end of the day, you want to make sure the results are good and the treatment is fast, and we can actually have the power under our control, and Ultraformer gives us all that.